Did you know that the blood pressure readings you get at the doctor's office may not be accurate? It is very possible that your doctor has wrongly diagnosed you with high blood pressure. There are several reasons why you need to start asking your doctor to check your blood pressure twice. It is quite often that blood pressure measurement goes wrong, and millions of Americans end up with the wrong diagnosis. In this video, we will learn about how you can really know if you have high blood pressure. But before we dive in, please make sure to subscribe to my channel for more videos on how to maintain a healthy lifestyle. Accurate and reliable blood pressure measurement is critical for the proper diagnosis and management of hypertension. So much so that even the slightest measurement error can lead to incorrect hypertension classification in 84 million individuals worldwide. Understanding the ways that blood pressure measurement goes wrong and how to tackle them can improve diagnosis and management of hypertension. As stunning as it may sound, nearly half of Americans ages 20 years and up, which is approximately 122 million people, have high blood pressure. The American Heart Association says there are 5 blood pressure ranges. Blood pressure numbers of less than 120/80 are considered within the normal range. Elevated blood pressure is when readings consistently range from 120 to 129 over less than 80. According to the American Heart Association, individuals with elevated blood pressure are likely to develop high blood pressure unless steps are taken to control the condition. However, did you know that in 2017, a new scientific guideline redefined what is considered high blood pressure levels? Previously, high blood pressure used to be defined as 140/90. There are many organizations that still believe that high blood pressure should be defined as 140/90 rather than 130/80. According to a new study, 3 out of 5 people that are diagnosed with hypertension actually only have mild hypertension and do not necessarily need to take prescriptions. So checking your blood pressure is a mainstay of every medical checkup. Unfortunately, blood pressure measurement performed in clinical practice often leads to errors in 20% to 45% of cases. There are instances in which the blood pressure measurement accuracy is affected by patients' habits or behaviors. Acute meal ingestion, caffeine or nicotine use can all affect blood pressure readings, leading to errors in measurement accuracy. It is important for the patient to rest comfortably in a quiet environment for 5 minutes in a chair. The patient should also have an empty bladder and not have eaten, ingested caffeine, smoked, or engaged in physical activity at least 30 minutes before the measurement. Inaccuracies in blood pressure measurement can also occur due to errors related to the procedure. For example, having the patient's arm lower than the heart level can lead to an error. Procedure-related error might also occur if the patient's legs are crossed at the knees or if talking occurs during blood pressure measurement. A quick cuff deflation rate also can contribute to inaccuracy. If a cuff is too small or too large, errors in measurement may occur. Adding to the inaccuracy are automated devices that have not been tested for accuracy, which can account for errors in systolic blood pressure. New studies advise that you get your blood pressure checked twice for a correct diagnosis. According to a study published by the Journal of the American Medical Association this week, patients who had their blood pressure checked a second time at their primary care doctor's office often have a lower number. The truest blood pressure reading is taken after sitting quietly for at least 5 minutes, and that rarely happens in a doctor's office. Uncontrolled high blood pressure can lead to heart attacks, strokes, and kidney disease. Almost half of the people seen by primary care doctor do not have their high blood pressure controlled. A primary care office visit usually takes 15 to 20 minutes, and checking a patient's blood pressure, which is one of the most common reasons people see a primary care physician, actually takes less than 1 minute. While a second check will take up another minute in already a short doctor's visit, it is a minute well spent. The lower reading avoids unneeded medication, decreases secondary fatal effects of hypertension, and will likely decrease overall healthcare costs. But if your blood pressure is definitely high, there are some changes that can be made to your lifestyle to help improve your levels. You may be wondering if the foods you eat could play a role in your condition. And the answer is yes. Lifestyle factors such as diet can have a major impact on lowering blood pressure. In fact, some older adults are able to get their blood pressure under control just by changing what they eat. This in turn can potentially reduce or even eliminate their need for blood pressure medication. It is well understood that salt, which is primarily made up of the mineral sodium, can contribute to high blood pressure levels. According to the Centers for Disease Control and Prevention, Americans consume far more sodium than they need. The dietary guidelines for Americans advise that adults should consume less than 2,300 milligrams of sodium each day. If you have high blood pressure, the American Heart Association recommends an intake of no more than 15 milligrams per day. While watching your salt intake is important, it's only one part of the equation. If you want to reduce your risk of a heart attack, stroke, or other complications, fill your plate with blood pressure-friendly foods. A recent study showed that yogurt may produce positive blood pressure outcomes for those with hypertension. This is attributed to its high amounts of the minerals calcium, potassium, and magnesium, all believed to help regulate blood pressure. Strawberries and blueberries are also rich in antioxidant compounds called anthocyanins. Research has linked anthocyanins to a reduction in blood pressure in people with hypertension. In more good news, berries are very delicious. Sprinkle them over your yogurt, oatmeal, cereal, or enjoy them as a sweet afternoon snack. Beets are high in nitric oxide. It is a compound that's been shown to reduce systolic blood pressure. Try beets as a side dish or add it raw to salads. You can even purchase beetroot juice to drink on its own. Sweet potatoes are loaded with magnesium, potassium, and fiber. This side dish superstar is a delicious way to lower blood pressure. In addition, cabbage, collard greens, spinach, kale, and other greens are high in nitrates, which have been found to offer blood pressure benefits. It's easier to get your daily dose of greens by varying how you consume them. For example, you can saute spinach for a tasty side dish, add fennel to your soup, or bake a batch of kale chips in the oven. Oats and other whole grains contain a type of fiber called beta-glucan, which may lower both systolic and diastolic blood pressure. Start your morning with a bowl of unsweetened oatmeal. Use whole grain bread for your lunch sandwiches, or have a side of seasoned quinoa with dinner.